Here's a startling fact: babies born to black mothers in England and Wales are a staggering 81% more likely to die in neonatal care, according to a groundbreaking NHS study. But here's where it gets even more alarming: this isn't just about race, it's also about poverty. Babies from the most deprived areas face a 63% higher risk of death compared to those from wealthier backgrounds. This raises a critical question: why are these disparities so persistent, and what can we do to change this? The study, conducted by researchers at the University of Liverpool, analyzed data from over 700,000 babies admitted to NHS neonatal units between 2012 and 2022. The findings are stark. Black babies had the highest mortality rates for most of the years studied, with 29.7 deaths per 1,000 babies, compared to 16.9 deaths per 1,000 for white babies. And this is the part most people miss: even after accounting for maternal and birth factors, socioeconomic and ethnic inequalities still explain a significant portion of these disparities. Samira Sabarian, the study's lead author, emphasizes that addressing these gaps requires more than just improving clinical care. We need to tackle the root causes of inequality, she explains. By focusing on the broader social conditions affecting families, we can give vulnerable babies a fighting chance. Here's where it gets controversial: while the study highlights the role of socioeconomic factors, it also reveals that babies born to Asian mothers face a 36% higher risk of death compared to white babies, even after adjusting for other variables. This suggests that systemic biases in healthcare delivery may play a role, a point that's sure to spark debate. Are we doing enough to ensure culturally safe and equitable care for all families? These findings come on the heels of previous reports showing that black babies are nearly twice as likely to be stillborn as white babies. A national investigation into NHS maternity services, set to conclude this year, will examine racial disparities in maternity care. But the question remains: will this lead to meaningful change, or will these inequalities persist? Rachel Drain, from the Royal College of Midwives, calls the findings deeply concerning and urges urgent, coordinated action. She stresses the need for equitable care, workforce investment, and services designed with women at the center. Every baby deserves an equal chance at survival, she asserts. Rising mortality rates and widening inequalities are unacceptable. Professor David Taylor Robinson adds a sobering perspective: despite pledges to create the healthiest generation of children, our findings show that too many face significant challenges from birth, or even before. He hopes the evidence will drive action to address the societal factors shaping health outcomes. But here's the real question: are we willing to confront the biases and injustices embedded in our systems, or will we continue to turn a blind eye? This study isn't just a call to action, it's a mirror reflecting the stark realities of healthcare inequality. What do you think? Are these disparities a result of systemic failures, or is there more to the story? Let's start the conversation in the comments.